We have 3 major hospitals on the island, 2 state-run and 1 private. All have significant financial problems which will affect your citizens. What do you see as the role of the county and you as mayor in particular to help move this problem towards solution? And please be as specific as you can. 90 seconds.
Everybody needs a very vibrant and healthy healthcare network. And when I look at the state hospital system, again, it's similar to the Department of Education, layered with bureaucracy. And when you look at it, how much of that is with the state corporation of Honolulu? My plan would be to actually talk and see if we can actually have these hospitals come under county control. And the reason I'm saying that is it's going to come back to whether all of you as taxpayers want to have control and destiny, home rule over your own health care. Because I've talked to doctors. At first, doctors said, well, gee, I don't know if this can be done. Then after we started the dialogue, they actually said, you know what, we could buy into that because now we would have a vested interest in actually managing and running these hospitals. Right now, a lot of our doctors in our community, they don't have management rights. It's an administrator from Honolulu that's actually running the hospital. Our own physicians in our area are almost treated as visiting physicians. They're just the same as if somebody from Honolulu came here to do a surgery or came here to treat a patient. So I think we have to seriously look at possibly taking the healthcare system on our island under our control. Is it going to be costly? Yes. But again, the question will be, if our healthcare network is not healthy and vibrant, then our community is not healthy and vibrant. So I think that's money well spent, and we should take a real good look at it.
Thank you very much, Councilman Higa. Mr. Maslamoni, please take it next, the hospital question.
Okay. I worked in the North Hawaii Community Hospital, and one of the things that we need to learn, number one, the hospitals don't make money. Okay, if you break even, you're okay. But most of the time, if you have a patient come in and you look at the chart, every bed is full. How come they're not making money? It's simply because the insurance company's reimbursement is based on what we call diagnostic code. They pay by the diagnostic code, not by how many hours you spend. So therefore, recently, our state government has released, through the Hawaii Health System Corporation, the state released $11.8 million. Guess what that money went to? For the account payable balance. And then $1.3 million for the system malpractice insurance. Why is that we're having a problem? Because many of the doctors, and I have my brother, I have my sister, they're medical doctors, and they can't practice any medicine because the liability and the malpractice insurance is so high, they have to start looking for something else. And therefore, we need to start thinking that in order for us to have a successful, that we need to negotiate with the insurance company to make sure that it's friendly to the people who are coming as doctors and nurses to work here in our hospitals.
Thank you, Mr. Maslamoni. We're going to Mr. Riley, and then we'll go to Mr. Barroso.
The key word here is state-operated. Both of the Department of Education and Department of Health doctors are governed by the state. I would also entertain the idea of creating county-operated DO, Department of Education and Health. But I have talked to my own personal physicians in Hilo. They have also entertained the idea and think it could be also feasible. So I too agree with making them county-operated. Thank you.
Thank you, Mr. Riley. Mr. Barroso, talk to us about the hospital situation, please.
We need medical. I know that we do need medical units, and we need hospitals also, and we need doctors also that can help us, because the population is getting bigger and bigger, and we need medical assistance. Thank you very much.
Thank you, Mr. Barroso. Senator Inouye, the hospital issue.
Thank you. The mayor certainly can assist our hospitals by the lobbying and advocating at the state level for funding and additional services. The mayor can also serve as an advocate for other healthcare providers, such as the Bay Clinics and rural healthcare providers, outreach programs as well. This is a problem that can only be addressed through partnerships, certainly with government, healthcare providers, business, union leaders, and concerned citizens. As mayor, I would rally these groups to work together to address the crisis. But let me share with you that creation of the recent HHSC local boards was a step in the right direction for the state. with the leadership, under the leadership of Dr. Josh Green. Let's be honest about this. There are no magic solutions or silver bullets. Healthcare is a national problem that will take a tremendous effort at all levels of our society to resolve. Healthcare should be in the hands of the state. I disagree with two of my colleagues. County government has our own problems. We need to build our roads. We need to increase our bus services. We need to build our landfills. And certainly, I don't think it's in good judgment that the county should take over the health care system. Thank you.
Thank you, Senator Inouye. We're going to Councilman Pilago, followed by Mr. Moore.
Thank you for the question on health care. Health care, our quality of life, is our responsibility. When we get ill, when we ail, it's our responsibility. It's a disgrace. When the mayor suffered a recent heart attack, he had to be sent over to Honolulu for services. What about the rest of us? As mayor, I need to be the lead negotiator to make available county lands to hold consortiums together of private industry, service providers, community, and government into task force to make sure we take care of our health and our welfare and security issues. The county government not only makes available our lands, we are committed to do the infrastructure work as part of our ability to earn our way to be the lead negotiator and hold these partnerships together. Community input is strongly recommended in these cases as shown and evidenced by our Waimea Hospital. I'm also a strong supporter of tort reform. That needs to be taken care of. Back again to the original place and the original issue. Health, welfare, medical clinics are all our responsibility, and the mayor's office, my office, as executive of the county, it is my responsibility to be the lead negotiator and hold these partnerships together. If other people don't do it, let's do it ourselves.
Mr. Moore, start him over again.
Okay, it's Mr. Moore. Again, when we look at our general fund and where we're spending our money, again, it just jumps out at you. Health, education, and welfare, that's 4%, what is it here? Almost 5%, but that's, that's all three of those combined. We're looking at only 2% going to education, 2% going to health. We're not spending any money on us. We need to change the directives of the mayor's office. We need to start spending. I would like to see us spend money on the people. 4.9%, 5% on health care is not enough. Why would a doctor want to come to a community that represents itself with such a small percent of taking care of its people? If any sign of a community that cares about the folks who live there, they spend money on them. We're spending money on roads. I feel sometimes like I'm in Los Angeles story or something about roads, roads, roads. Folks, we've got to give up the idea that we're going to be able to drive our cars wherever we want, park them wherever we want, whenever we want. That paradigm, that world is over. It really is. We need to work together. We need preventive medicine as soon as possible. Thank you.
Thank you, Mr. Moore. And Mr. Inouye, please tell us your solution, if there is one, to the hospital problem.
Thank you. There's a couple solutions that we can implement here at the county level in a leadership role, especially from the mayor's office. One is the expansion of long-term care alternatives in our community, where the county can expedite permits for the establishment of long-term care alternatives and to provide tax incentives for that to happen. Currently, the state of Hawaii loses $110 million a year because we lack access to long-term care beds that are taken up by short-term and emergency care beds. That's one option. The second is expanding our physician base so all of us have access to physicians. We've worked with Dr. Green, the legislature, for the establishment of a Hawaii Island Rural Residency Program so that we can have our John A. Burns School of Medicine physicians do their residency here on Hawaii Island that will allow them to then stay and practice medicine here. When I sat down with over 20 physicians and talked about what is the one thing we can do that would improve our healthcare system. We just lost 62 million shortfall here at HHSC. And this is what they said. In Alaska, physicians are allowed a 20 to 30% premium because for Medicare and Medicaid reimbursements because of limited physicians, large geographical base, and lack of infrastructure. The very same conditions that exist here in Hawaii, especially with the collapse of Aloha Airlines. And this is why we go to our federal government, our congressional delegation, and specifically our senior senator, insert that provision that all of the doctors agree will then expand our physician base.
Thank you very much, Mr.